Hi, how are you? My name is Joe, I'm 7 years old, and I'm here to talk to you about childhood bruxism. Do you know what bruxism is? Bruxism is the habit of clenching or grinding your teeth, often without realizing it. It can occur during sleep or when you are awake. This may result in wear facets, which make teeth shorter, flatter, and more sensitive. Pain in the face and jaw caused by repeated contraction of the masticatory muscles. Sleep disturbances and daytime fatigue, as nighttime bruxism interrupts adequate rest. Damage to orofacial development, as the jaw and maxilla are still growing, and excessive muscular effort can influence their formation. Just like my parents, you must be wondering, what causes bruxism? Parafunctional habits, nail biting, biting objects, or resting your chin on your hand for long periods of time also contribute. Children with family members who have bruxism may be more prone to the condition. Problems with the fit between the upper and lower teeth can stimulate unconscious compensatory movements. Emotional factors, stressful situations, anxiety and insecurity. Sleep disorders, poor sleep quality, and excessive screen use. These factors pose a greater risk to children, because at this stage our bodies are still growing and changing significantly. The bones of the facie are developing and we also change our teeth, making this area more sensitive and unstable. And so, we need help to prevent this, and we are counting on you, parents and guardians, to do so. What can we do? Have regular dental checkups. Establish a proper sleep routine, with fixed schedules in a calm environment. Sleep hygiene and reducing screen time, especially before bedtime, to improve the quality of rest. Promote the child's emotional balance, avoiding overload with activities, and encouraging moments of leisure and relaxation. That's IT. I really enjoyed talking to you guys. I hope IT helped. Hugs, and see you next time.